our weekly update for our community, for our Nashua community, about the status of the city's response, community response to the coronavirus pandemic. As usual, I want to reiterate that you should continue to have your social distancing. By that, I mean stay at home as much as you can, keep apart from people. This, we believe, has been having an effect in helping keep the spread of the virus to a minimum here in Nashua. We do, and you'll hear from Public Health Director Bobby Bagley, that we have 70 cases in Nashua. But at least so far, and we're keeping our fingers crossed, this is not nearly as many cases as we could have had if we hadn't been doing our social distancing. As you probably know, City Hall has been closed to the public. People are working remotely. Our first responders, who you're going to hear from, are taking steps with personal protective equipment. This is called PPE, to protect our police officers, our firefighters. And these are some of the things we're doing to try to make sure that the virus doesn't spread. Before we go further, I want to thank the people, special people in our community beyond those who just work for city government, for going to great lengths to keep our community safe. First, our healthcare workers, our doctors, nurses, others in the emergency rooms, the hospitals, our doctors' offices, because they are on the front lines of this crisis. I met with some nurses this week, and of course, they're in the emergency room. They're seeing coronavirus positive people every day. They, of course, are therefore exposed to the possibility of becoming infected with the coronavirus. And they all have kids at home, families who they're worried about, but despite continuing to do their job, continuing to help us keep safe, care for people who have the virus. And so they've been doing a great job. Also, I wanted to mention that this time, make a special mention to our public works workers. They're out collecting your trash. They're out fixing streets and things. We have taken steps to limit the contact between public works workers. People who are out there are going out in very small teams. We have masks for everyone, and we've taken other measures to make sure that they are kept as safe as we possibly can. But essential services such as picking up garbage and doing some of the other things that Public Works does, we want to continue to provide those services during the coronavirus crisis, because of course we know it's already gone on a few weeks, and we expect it's going to go on quite a bit more. So we want to make sure that your services are performed in as safe as manner as we possibly can. Another group of people I think that I definitely want to thank are the teachers and other school personnel who are working extra hard to do remote learning. If you talk with our teachers, you will hear that this is not easy, it's a lot better to be in the classroom. But they're working hard to try to educate our kids as much as they possibly can during this time when the schools are closed to classroom sessions. Those are another group of people who are really very dedicated to making sure that the well-being of our community, of our kids, is maintained. We also have many volunteers who are working hard to reach out to those in need. We have volunteers who are working every day to bring meals to kids at various schools. Kids who don't have enough to eat can come to school and get meals. In addition, there are teams of volunteers who are using the transit buses to deliver meals to locations in the city that are distant from some of our schools, and where kids can get meals directly from the bus rather than having to make a long trip to school. And I know from talking with many of the people working on these various projects, they too are helping to serve. We have, for example, people that work in our school cafeterias, packing meals, volunteer, no compensation whatsoever, to put on the buses that can be delivered to school kids. So it's a huge community effort. Again, I want to thank everybody involved. Director Bagley is going to update you about the cases, and you'll hear from uh, Chief Carignan and Chief Rhodes about what's happening with the police and fire departments. Justin Cates is going to talk to you. He's our emergency management director, about more of the efforts that are going on. But before I conclude, I want to remind you once again that we want you to stay as much as possible. This is a definite way to stop the spread of the coronavirus. Stay at home as much as you can. Try to work remotely if that's at all possible. When you go to the store and around the community, wear a mask. This helps to guard against the spread of the disease, because many people have this disease. Some people have this disease who don't have any symptoms. So it's possible for any of us to have caught the virus and be carrying it despite the fact and contagious to others, even though there are no symptoms, no obvious symptoms. In any event, I'd like to thank all the people that are going to be speaking to you. Everybody's doing a great job, and we hope to give you a weekly update. If any questions come up about the coronavirus epidemic, Public Health has a hotline, which Director Bagley will tell you.
Yes, so good afternoon, everyone. My name is Bobby Bagley. I'm the director of the Division of Public Health and Community Services, and I work with a team of public health nurses, environmental health specialists, an epidemiologist, our welfare manager, chief public health nurse, that are all working together with our partners to help mitigate and contain the spread of COVID-19 in our community of Nashua and in our region. I'm just going to provide some numbers that show globally what things look like, as well as how things look nationally for us, and then give some more local data from our state and then from the city of Nashua. So right now, there's a total of over 1.5 million confirmed cases in the world. And in the United States, we are up at the highest number of confirmed cases right now by country and by region at 432,596 cases. In the United States, we have seen that there's about 24,245 cases that are reported as in recovery. In the state of New Hampshire on Wednesday, our Department of Health and Human Services announced that there were 41 positive new cases in New Hampshire. And so we have a total of 788 cases of COVID-19 currently diagnosed. For our region here in Hillsborough County, for us in Nashua, we have 74 cases reported out right now. And in Nashua, we are reporting 18, in the state, we're reporting 18 deaths that have been attributed to COVID-19. And in Nashua, we have reported 5 deaths that have been as a result of COVID-19. This viral infection tends to hit those who are over the age of 60 and in a very serious way and very complicated. Things happen with individuals that are over the age of 60, as well as those who have underlying health issues. And so some of the mitigation factors that we put in place, as the mayor talked about, with the social distancing, with staying at home and only going out if there are reasons, essential reasons for you to be out, are really, really important, because as we have learned, this virus can be spread to individuals very easily by air droplets. And individuals can come in contact with those air droplets when people sneeze or cough, and their cough is not covered or the sneezes are not covered, as well as come into contact with the virus on surfaces. And so there are a number of factors that we want people to make sure that they have in place with covering their coughs. We have the wearing of the cloth mask as one of those measures that will help prevent your respiratory droplets from being spread in the community. That is not a part of the personal protective equipment that the hospital or first responders are using, but it can stop your spread of respiratory droplets in the community. Wiping down surfaces is also very, very important because the virus can live on surface areas for hours to days. And so you want to make sure that there's constant and frequent wiping down of surfaces with disinfecting solutions as according to what's on the manufacturer's label for those products. The social distancing is really important. What we have noticed in our contact investigation and observation, with this disease, when people are not gathered together in small places where they're crowded together, it reduces the spread of this infection. In fact, it allows for that chain of infection to be broken. And so wearing of the mask will help that. Social distancing will help that. If you're sick, stay at home. If you feel that you need to be seen by a healthcare provider, make sure you call that healthcare provider first. Don't just show up in emergency rooms. Do not just show up at your doctor's offices. Make sure you call them first. Explain what your signs and symptoms are, and your doctor will give you recommendations on how you need to treat or be taken care of. And you want to follow those instructions very, very carefully. We are still continuing to monitor as new cases are reported to us. We will do contact investigation, which means we find out more about the individual circumstance, their situation, and individuals that they may have been in contact with, so we can provide the education that's needed, again, to help stop the spread of this infectious disease. Some of the signs and symptoms may include things as simple as a headache, fever, cough, sometimes shortness of breath. But we've also learned that individuals will have other symptoms that are not as common, something as simple as a runny nose. Some people have had diarrhea. Some people have had just a little scratchiness in their throat. All of these things can be identified or associated with COVID-19 infection. Body aches as well. Just overall, just not feeling well. If you have these types of symptoms, again, what you can do is do the social distancing. Make sure you call your healthcare provider, who may or may not recommend testing. If testing is not recommended and your healthcare provider tells you that you need to stay at home and quarantine yourself, and you want to do that. And the quarantine that's recommended is for 14 days, and that is not having contact with anyone outside of your home. And even in your home, you want to make sure that you maintain some distancing so that you don't spread the infection to your loved ones in your home. The recommendation of wearing the cloth mask is going to be very important, again, to help reduce the spread of infection in our communities. I'm going to turn it over now to Chief of Police.
No, I think to me first.
To Justin. I'm going to turn it over to Justin, our Office of
Perfect.
Emergency Management Director.
Thank you very much, Bobby. So I appreciate the opportunity to talk to everybody today, give everybody an update on the city's response to COVID-19. All of our city divisions have been really working well together, not just within government, but working well with the businesses in the community, as well as those nonprofits in the community who are also taking a very active role in our response to this incident. So I wanted to provide an update on some of the task forces work that they've done over the last week. The mayor had provided some information on the work that the Community Distribution Task Force has been working towards, helping to distribute meals in the community. And Bobby has gone over the work that the Public Health Response Task Force has done to continue the efforts to build out the alternate care site over at Nashua High School South, as well as the contact tracing and the other public education work that's been done to try and mitigate and contain the spread of the coronavirus. So some of the other task forces that are in place that we've been working towards is the Municipal Continuity Task Force. And the Municipal Continuity Task Force, again, was focused around the ability for us to continue those essential services in the community, primarily fire suppression, law enforcement, making sure EMS coverage is provided, ensuring that we're able to maintain our solid waste pickup, wastewater services, all those things that have to continue regardless of this incident. The city divisions have been doing a really great job performing those tasks with new cloth masks that will assist them in preventing the spread of the virus from them if they were to have it to the other employees or to the public. We're also working on continuing to provide additional cleaning supplies for those entities, hand sanitizer, as well as personal protective equipment so they can continue their support. We still are short on personal protective equipment. There's still challenges with the supply chain on getting the necessary supplies for personal protective equipment, but our administrative services division has done a great job at trying to get what they can from the supply chain. The school issues task force has continued to work towards remote learning and continue to troubleshoot any issues related to the provision of Chromebooks out to the community, and is looking towards how they might be able to continue these services under a very long period of time. So Dr. Mosley has done a great job at continuing under these very difficult circumstances, and hopefully, as the coming weeks come upon us, we'll be able to see further as to what the rest of the school year is going to look like, and we hope to have him on a future press conference. Economic Recovery Task Force has continued to work with the businesses in the community to look at ways to ensure that our businesses are strong, not just during this crisis, but as we go into recovery as well. They have put out a business impact survey with the intention to try and pull some information from businesses as to what their concerns are and really what we can do as a community to assist them through this crisis. So we hope to get more insight from those businesses through that survey over the coming week. The other thing that Economic Recovery Task Force has worked really great to try and bring into the city has been a map to show those businesses that are open for business, those that have modified their services, as well as those who are working to provide online-only services. So that map can be seen on our COVID website, www.nashuanh.gov/COVID-19. That website has information about the status of businesses, how to report yourself as an essential employer, and many other really great resources. The Homeless Support Task Force has continued to work with the state to identify some additional surge capacity for the shelters within the community. And we hope to do a walkthrough of a potential site on Monday with the intention to try and get that facility up and running as soon as possible. And then the Child Care Task Force has continued to work to identify the status of child care facilities within the community and better understand the needs from fire, police, and healthcare workers within the community that still have child care needs even during this crisis. And in addition to those task forces that we've established as a city, I think it's really important to recognize the strong work that's been done by our support services, ranging from the supply unit that administrative services is taking care of, bringing in the necessary personal protective equipment and cleaning supplies for our city divisions. Our cost unit, run by our financial services, keeping track of the many different federal grant programs that have come out of this disaster, and ensuring that we're getting reimbursed as much as possible for all the services that we're providing. And then the Joint Information Center. The Joint Information Center, they're behind the great work that you've seen on social media, and even behind this press conference that's happening today. So they've done some really fantastic efforts to try and ensure that all of our city divisions have one unified voice as we move forward. So in the coming week, we'll continue to procure supplies for the alternate care site that Public Health is managing. We'll also continue to provide additional support to the Economic Recovery Task Force so that they'll have some potential support on a recovery strategy for the community. And we'll continue our efforts every day at 10 a.m. to hold collaborative planning meetings with all of our city divisions so we know what's to come. Thank you very much, and I'll pass it over to our next presenter.
Good afternoon, everyone. For those of you who don't know me, my name is Michael Carrigan, Chief of Police in Nashua. I'd like to start off by saying thank you very much to all the citizens and the people that are coming to work every day in Nashua. For the most part, you've been very cooperative with us. You've been honoring social distances. You've been cooperative with the police department, not committing as many crimes, which we greatly appreciate during this time. We are still fully functional. We are answering all calls for service. Sometimes those calls look a little bit different. When you call the police department, you're going to get a series of questions to see if you've possibly been exposed or in any way could expose our officers to some of the COVID-19. So those questions will come. In addition to those questions, we will ask you to meet the officers outside to have a discussion to solve your problems from a distance of at least 6 feet or greater. This is not typical of the way we conduct business, but I think in this day and age, it's very important for us as law enforcement to make sure that we don't become in contact and expose each other to potential COVID-19. We're also, you may see from time to time that we are asking you to handle the calls for service over the telephone. If we don't need to have contact with you and risk exposing each other, we're not going to do that. We are also spending a lot of our time driving around to local parks, local skateboard parks, basketball parks, and ensuring that those that are closed remain closed and people aren't on them. And our philosophy now is to educate you and to remind you what social distances are and why it's important. We've had a couple of issues at some of the skate parks, which we're working hard to make sure we press that education and encourage the young kids of Nashua to stay out of there for the time being for everybody's safety. Again, we really appreciate your cooperation. You'll see us on bike patrols in the parks, all the local parks and Mines Falls areas, reminding you to stay safe. If you do have any problems or any issues, please call 911 if it's an emergency, or call our non-emergency number at 594-3500. I'd also like to remind people that as we're all stuck inside, there are still cases of abuse against children or domestic violence abuse cases. These are something that normally people see out and about on a day-to-day basis that may not be seen. Please know that you do have support. If you are a victim, you have support. You can reach out to us, the National Police Department. You can reach out to our domestic violence services through Bridges. You can reach out to DCYF for any help with children or any abuse issues. We encourage you to do so. We encourage you to be mindful that as everybody is stuck together, it is normal for you to feel stressed out. It's normal for you to feel pressure. And we'd like to encourage you to please don't not call if you're feeling unsafe. We'll be there to help, as will the fire department and all those resources I mentioned. So we appreciate your continued cooperation, and we look forward to being done with this and getting back to all being able to be together. Thank you very much. I'll turn it over to Chief Brian Rhodes of the Nashua Fire Department.
Thank you, Chief. As Chief Karinga just said, I can only expand upon thank you to the members of our community who are practicing social distancing, who are staying home and heeding the words of the experts. Let me give you a little update as to what Nashua Fire Rescue has been up to during this. But first and foremost, as the proud chief of this department, I cannot tell you how very proud I am of the men and women of Nashua Fire Rescue. The COVID-19 pandemic presents a lot of challenges for our people, and they have and will continue to work tirelessly to adapt to and overcome these challenges presented by this worldwide situation. Rest assured that we are here for you in your time of need if you need us. We have and will continue to respond to all hazards throughout our city. The one exception is our dive team, which is currently out of service for the COVID-19 incident due to our concerns about the health and well-being of our team members. I'm pleased to report at this time that we do not have any members in quarantine or who are sick with COVID-19, but we do have a continuity plan in the event that this should change. Early on in this event, we stood up what is called an incident management team. And this team has worked incredibly hard to modify and forecast our operations in response to the challenges that the COVID-19 pandemic presents. Currently, we are responding to approximately 8 confirmed or suspected COVID-19 incidents per day. The sustainability of our PPE supply is an ongoing concern, but at this time, we currently have enough stores to safely protect our responders. For the safety of our staff and our citizens, we have been diligent about adapting our non-emergency service model to accommodate the safety of all. This includes burning permits. As the weather gets better, we want to make sure that everyone has the opportunity to get out and enjoy fresh air. A process will be rolled out very soon that will allow city residents to obtain a fire permit remotely during this COVID-19 event. This process will be announced by the city as well as the fire department through various channels. The Safe Station program is still active, but with that said, we highly encourage those seeking assistance to call 211 to be connected with the state of New Hampshire's Doorway program. We have seen a decline in the daily number of Safe Station requests and have modified our procedure for the safety of all and ask those seeking help to please follow the instructions of our firefighters. If individuals are unable to connect via 211, we will continue to serve our vulnerable citizens who are struggling through addiction. Last but not least, if you are experiencing a serious medical emergency, do not, I repeat, do not hesitate to call 911. If you are experiencing flu-like symptoms, please contact your primary care provider for guidance and support. And again, to all the Nashuans out there, thank you. Thank you for your support of all of our city operation, because your city is working very hard to ensure you have a safe and healthy future. Thank you.
So who's next? Anyone? Have we completed?
I think we've completed with the folks who are going to be speaking. Adam, did you want to ask a question?
Yes, yeah, I would. I was curious, other than the Huntington at Nashua, if officials are able to identify any other locations in the city where COVID-19 is present.
So Adam, the only outbreak that we've had is the cluster outbreak at the Huntington facility. We have had cases in different areas and different, if you want to call them like small groups, like individual families and contacts of the family, individuals that may have been exposed at their workplace, at the hospital, but we haven't had any cluster outbreaks. Right now in Nashua, we have a total of, we're doing over 150 investigations for contacts to our cases that we have here. But there have not been any other things that are termed as outbreaks.
Okay. And may I ask another question?
Sure.
All right, I think this one's more for Chief Kerrigan. I know a moment ago, Chief Rhodes had said that no members of the NFR are currently in quarantine or sick, but I was curious if there was any police officers who might be.
Yeah, Adam, we had one officer test positive for COVID-19. It was a non-work related exposure. He was quarantined and will be out through the remainder of his recovery. He is doing well, and two officers that were in voluntary quarantine because they were connected with him and were potentially exposed through him. So we've isolated them for 14 days. We had 7 other police officers and a civilian out after they had dealt with a suspect who tested positive. They are returning to work yesterday, some today, and some tomorrow.
Well, I hope you've enjoyed our remote press conference, our remote information session. This is the first try at this, so please bear with us. We are going to update the community every week or so. And thank you, Carrie, for putting all this together. We will see you. We'll see you all soon.
And Mayor, I did want to share our COVID hotline number with folks. If folks have information, have questions and want information, our COVID hotline is open and available 7 days a week from 8 a.m. till 9 p.m. and it's staffed by our public health nurses and other staff here at the Division of Public Health and Community Services. If you have questions, you can call 589-3456 and someone will be able to answer your call at those times. And it also goes to a voicemail and someone will get back to you as soon as they can.